All right, guys, welcome back to a new video. This is a very special video because I'm here with a very special patient from New York who found us through another dentist. Elizabeth, tell us about how you actually found us, and we'll ask you more questions after that.
Yeah, I had implants in my upper
Mouth.
yeah. And they didn't hold because my bone is not that good. So at the end of about probably 3 years of putting them in and trying them again and all kinds of bone grafting and everything, I was left with no alternative except a denture.
So you've had your implants placed a couple of times?
Yeah.
And they all failed?
Yeah. Yeah.
And who's the dentist that referred you here?
So then I saw this dentist advertising in Saratoga. His name is Dr. Benjamin.
Okay.
And he has a very nice ad on TV. It's like Benjamin Smiles. So I decided if I'm going to have to wear dentures, they're going to be nice. So I went to him and he said, I can put you in the direction of the perfect person to get that done. And he said, they would probably be able to put in implants for you because they're amazing down there. So he gave me your name and address and I called up and that started this journey.
So you actually fly from New York to come and see us.
Yes.
So this is kind of a destination dentistry place for a lot of other patients as well, like hers.
Yeah.
But what's interesting, before the interview, you mentioned something about you've only came 3 times and you got your denture on the 3rd appointment.
Yes.
And you said the first time it was just a consult.
Really, yeah. And I think maybe you took some
imaging.
Yeah.
We took a CBCT
Yep.
to check your bone to see if you can get implants. And we discussed the implants that time, but it was different kind of implants than what you have placed before.
We were thinking, I think you had mentioned about the zygoma ones, but I wasn't ready to do it at that time. You know, I thought it would be okay. And when I got this denture, I was really, really happy with it. And I am still very happy with it. It's lovely. And every time I look at it in the mirror, I say, it's lovely. And I never think it's
a beautiful
not
smile.
Nice. But I would like to have something more permanent.
So you've had these dentures for
2 years.
2 years?
Yeah.
And you came in 3 appointments. Each appointment you flew in and out the same day. You
Same
never
day.
actually stayed in.
No.
So Elizabeth is coming back 2 years later because she came right before Corona, and 2 years now. And she's starting the process of the zygomatic implants. And those are a much longer implant, much more complex. And her case will be completely guided with Dr. Salama and our team here, and I'll be restoring the final dentures or the final teeth, fixed teeth. So tell us about your feelings before the surgery, because we're gonna ask you very similar questions about how it feels when it's all done. So what are your feelings right now? I know you said you were not prepared for these kind of surgery.
I wasn't prepared for it then because I think, you know, with me anyway, the way I function is I have to kind of experience things. I have to know what it feels like and then I can move on to the next decision. So I knew when I had the teeth, I'm like, this denture, and I said, it's so beautiful, it would be nice if it was forever, you know?
Yes.
So, but I was kind of, I think, nervous about the zygoma implants because I think they're relatively new. And I inquired around a few places and I went online and I researched it and everything like that. And I understand the science of it all.
Good.
So, and I just think that it's a wonderful option for people who are like me and don't have enough bone to hold an implant. And I'm sure if people knew about the zygoma implants right away when they were getting the little small ones put in, they should just go right to the zygoma. That's what I would say for an older person.
You know, New York is a big city, and you have a lot of dentists who are very capable, and you chose to actually fly back here to get this treatment done. My first question is why? Because you already have the teeth set up, so any dentist can really try to do the zygoma implants and give you similar teeth. Why did you choose to come back here, even though you know it's not a cheap treatment at all? It's very expensive and it's time consuming because it will take you about 4 appointments in total. Why did you choose to come back and do it here?
Well, first of all, I had a great rapport with you right from the beginning and I really trust you. I liked the office and once you go up and down to Atlanta a couple of times, it's not that bad a journey. So the other option then I was thinking about was New York City. But New York City is a 3-hour, from where I live, is a 3-hour train journey away. And I couldn't find, I did inquire at a couple of different dental offices, but I couldn't get the consistency and everything being done together at the one time with everybody there. I had got a lot of kind of disjointed, there was one guy who could put in the zygomas, but he's just a surgeon, and then I would have to go to somebody else to get the next part done. And I was saying, like, that, that's not what I want. I want to go and get it all done and
in one place.
Be finished, and have somebody there. And very important for me is the aesthetics and to see if I have a nice smile when I'm finished. And I suppose it's vanity or whatever, but I don't have anybody else at home that I have to kind of look after anymore. My daughter now is getting married, so I figured I'll just spend a little bit of money on myself.
And that's always a good thing. A smile goes a long way.
Yeah.
Definitely.
Yeah.
So it's very interesting. I just wanted to highlight why would people come and see us. We are a practice with full capabilities of surgeons, restorative dentists, and a full in-house laboratory. So
yes.
Your denture was completely done here. Your final teeth will be done here in this office. Nothing is sent out. So
yes.
This is a big deal.
That is definitely a big deal, because you have everybody on the one in the one team, and we're all working
Correct.
on my mouth. It's not one person, but also I think I know, even though I will be. Knocked out having the zygomas inserted, but I still know that you will be doing a good job because I trust you, and you know exactly what's important to me. The putting in the implants and the surgery part, I have full confidence, but I know that you will go for the look that I like.
Something that you just mentioned that maybe a lot of people don't know as well is that we have a medical physician who comes here and sedate you completely, so you're under general.
Yes.
With protecting your airway, with intubation, everything, so the patient, you don't remember anything from the process, and it's actually done at the highest quality of care, because everything that we do in this office is actually guided. So we plan everything on the computer, on the 3D bone structures that we scan you
yes.
From your own scans, and then we make the surgical guides, and our doctors here use the guides and not just freehand the implants.
Yes.
Not that freehanding is wrong, but guided surgery is definitely more accurate.
Oh, definitely.
So,
it makes a lot of sense. It has there's much less error possibility.
Correct.
Yeah.
Well, I'm glad. Thank you for this interview. We're going to
sure.
interview you again
Yeah.
at the end, and hopefully you're going to have a great experience with our team.
I think so. I'm excited about it now. Now that I've got as far as here, the COVID 2 years sitting at home really got me going. I said, oh, God, I wish it was all over. We could, get started on this next.
I'm sure you've done a lot of research in those 2 years.
Yep,
Sometimes research can be scary, so don't believe everything that you see online. Feel free to call and ask the office for a consult.
Yeah.
And again, thank you for this quick interview.
You're very
Appreciate
welcome.
it.
Thank you. Thank you.